Welcome, everybody. We'll get started in about a minute. So, good evening. I hope everybody pours something fun to drink while we listen to Dr. Simcock tonight. Vivian, next slide. Thank you for joining us on our webinar. I am Wendy Golden, and I'm an endodontist and medical affairs at Sohn Endo. Tonight, let me review a little bit about what we're going to talk about with the objectives. We plan to discover techniques to increase your practice profitability. We're going to look at different techniques to integrate GentleWave into an optimized schedule. And we're going to learn methods for how to schedule team workflow and reducing chaos and stress. The webinar does include one CE. We're going to review the CE process. Your attendance will be recorded via our Zoom. We will send out a survey tonight via email, and then we will email your CE certificate will be emailed to you. If you have any questions along the way, please reach out to myself or education@sohnendo.com. So this is an interactive session. The best part is always Q&A. Your questions are encouraged. There will be a dedicated time for this after the presentation. Along the way, if you want to enter any of your questions in the chat box, that's recommended. We do love cameras on. It's not nice to talk to people with a live face. So if you're willing, please keep your camera on. It is my pleasure to introduce you to Dr. Rick Simcock. Dr. Simcock graduated from Albert Einstein. He is a coach and mentor to many endodontists. He's completed over 5,000 GentleWave cases, so he's an expert on talking about this. So I'm going to turn it over to you, Rick.
All right, thank you. I will begin sharing my screen here and get things started. Well, I hope everybody had a fabulous day, and lots of root canals were done, hopefully, today. And I think one of the things that I'm just most interested in endodontics is this idea of efficiency. And there's been a lot of people that have kind of resisted this idea of efficiency. And I think in kind of reflecting on how, because I finished my program in 1999, I just aged myself. And I remember that there was this big fight between single visit and multiple visit endos. And I think one group looked down at the other, and the others kind of were wanting to push the envelope. And I think one of the things that was interesting about that is, it ended up kind of being pretty much not that big of a deal. And my program always said, hey, single visit, go after it, learn what works, what doesn't work as far as flare-ups go. But one of the things about efficiency that I think has put us in such a great place right now is that we have the technology at our fingertips that the root canal procedure is taken care of. And now all that we need to do is wrap our brains around how our office systems, how we're functioning with our teams, how we're functioning as doctors within this, that we can now become truly efficient. And so I really want to try and stir the pot a little bit this evening. And, I would never go to a brain surgeon. I would never go to a medical provider that said, I want nothing to do with efficiency. Somehow efficiency has gotten this dark word, meaning that we're going to be rushing, we're going to be skipping steps just to get the procedure done. And that might be true in many decades past. But I think with this technology now, it's calling us to have efficient and productive offices. There's never been a better time to be an endodontist. And so my passion is going to be talking about this as we move through the different topics this evening. And so this is me, my wife, and our two little fur babies, our Frenchie Eloise. She's a little bit of a pill and keeps us on our toes. And anyway, she just had to have a little surgery. And so good news back, it's benign, she's doing good, and all that. So Basically, what we're going to be talking about this evening, one, kind of looking at technology. And one of the nice things, I can say whatever I want tonight because I'm not a paid consultant from Sonendo. And I think that allows a little different approach. Whenever I'm hearing somebody speak and they have to say, oh, by the way, I'm getting paid, I'm a paid consultant. Part of me kind of goes, okay, I get it. And I know that there's been so many great courses out there, and the gas money that gets people to travel and all those things. But I'm speaking tonight from an absolutely free space of I've tried everything, I've made a lot of mistakes, and I continue to explore in my practice ways to become more efficient. And in my thinking, efficiency, the patient benefits. And yes, there's a lot of other benefits as well. But in my opinion, everything is centered around patient care and patient experience and outcomes. So that's what I'm going to talk about. We're not going to talk about mechanism of action. We're not going to talk about clean flow too much. We're not going to talk about all of the great things that we've just come to really know and appreciate about Sonendo and GentleWave. We're going to talk more about the business side of things that I really want to get endodontists excited about what the possibilities are. And that's what the basis for our talk this evening is. So thanks, Wendy and Vivian, for getting this all set up for the introduction as well. I've been an endodontist since 1999. I've opened 2 scratch practices. And like I said, struggled through all of the things that go on with practices and staff and technology and overhead and all of these things. And I've had some great mentors along the way. And I think when this technology kind of hit me in 2018, I literally was like, okay, we've got this tool now that allows us to really, when we're done, we're done. And if we can't really grasp that and start, if the tooth is dry and we've gentle waved this tooth, it's time to fill the tooth. This idea of, well, let's just see how it goes and put calcium hydroxide in the tooth. I really feel that's kind of an outdated way of looking at what we do. And my rule in my practice is if we can dry the tooth, it's going to get filled. That's just the way it is. Now, the patient's advised about what might happen, could have a flare up, all of those things. So what I decided is that I really just enjoyed working with other endodontists and working on opening possibilities, because my practice really, I kind of had an open mind for many mentors and people that would talk about business and the effects of getting efficient in your business and having good systems. I just kind of fell in love with working with other endodontists and other practices and really getting into helping and assisting these teams to really function great. So one of the things that we're going to talk about for sure is having fun in our practice. And this was one of my mentors for many years, and he worked with some other endodontists as well. But I really took this to heart because, life, and I kind of put my practice in this thought and concept as well. It's like, being an endodontist is a privilege, right? We have to enjoy being an endodontist. And if we're not having fun in our practices, if we're not enjoying every day, if we're not enjoying the process, then we're not really practicing well, right? And that goes with our lives as well. If we're having a miserable experience every single day of our lives and we're just complaining about all these things that are being done to us and all these things, we're not living a great life. And I want to live a great life. And I want my practice to be a great practice. And I want to be excited to go to work. And I want to be overjoyed when my team gets excited about a result or dealing with maybe a difficult patient. And all of these things can be learned, and all of these things can be absorbed into your practice as well. And that's what we're going to be talking about this evening. We're not going to show any x-rays, right? Everybody has these beautiful x-rays, but I do like to show a couple that really kind of were the teeter-totters that kind of made me say, hey, this is the best way to clean a tooth. There's no way that I could do that and get these results with filing to a 4004 weapon of mass destruction. And that's the beauty of what we're doing. This has become almost an artistic endeavor, in my opinion. We're becoming more and more artistic as time's going on, and we're actually having to do less, which I just think is one of the most important things too. Well, I talked to a lot of endodontists, and I talked to a lot of practices, and some of the data that I've uncovered and grabbed and synthesized and put together, I'm going to share with you, because contrast is the essence of vision. And when we're able to see what we're doing with maybe what somebody else is doing, it allows us to, one, maybe grow, maybe say, hey, I'm doing a good job. This is good. But I think we want to be growing. Our practices, there's no such thing as a stagnant office. A stagnant office is really declining, right? And so my opinion about endodontic practices is we always need to be looking for ways to grow, to get better, to become more efficient, to really empower our teams more, and to be the best clinician that we can be. And right now, with this technology at our fingertips, there's never been a better time to do this. But some of the average data here, we got 4.5 days a week that most endodontists work, and that takes into account some administrative management of the office, which is a little bit of a waste of time for an endodontist to be doing, but we do it all, and sometimes we do way too much. The average offices does 4 to 5 cases a day, and some of those are consult and treat on the same day, but a big bulk of those are consult first, and then we have to find a time for that patient to come back to the practice. 9-hour days with some lunch. And this was the interesting thing in the offices that we've talked to, 80% of offices, and I think that number has started to go up a little bit, is that we do a consult first and then reappoint the patient. So that's not single visit endo, okay? We want to think about, from the patient's experience and the referring office's viewpoint, a single visit is patient calls, the triage happens with kind of what the information is, and we'll talk a little bit about how that process goes in my office. And that's what patients want. And so we want to make sure that our systems are giving patients what they would like. They don't want to come to your office and then have a toothache, and then they're not seen for another week or a week and a half. And in some situations, even booked out 3 to 4 weeks. And Wendy and I were just talking about this as we were getting going, is that this becomes a snowball. If we have to do consults on every single patient before we treat them on a separate day, this becomes just absolutely unmanageable. And if your office is booked out 3 to 4 weeks right now, I would be very uncomfortable with that. And we'll talk about why. But if I have a toothache and somebody tells me it's going to be 3 to 4 weeks, whether you gave me an antibiotic or not, I'm not okay with that. And the referring office and myself is going to say, man, there's got to be somebody that can see me sooner than that. So one little check is to say, how far booked out am I in my practice? And if it's more, and you'd be surprised at my practice, I am booked out maybe 2 days. If I get booked out more than 3 days, I've lost control of my referring offices and the patients who want to come see me. So just a little check on yourself there. But this is this whole idea, right? I mean, if you look at the amount of hours that the average endodontist spends in their practice, you say, oh my God, they're so busy. Oh, I'm so busy. I'm so busy. I'm so busy. But yet the profitability is just not there. We're missing something. And so I want to get rid of this idea of being busy. And I want for our minds to start wrapping around, we want to be profitable. And profitability, one of the foundations of being profitable is being efficient. A minimal effort as far as energy, conservation of materials, conservation of time, all of these things fit into profitability. I don't want to be busy. I don't want to be busy at all. I want to be profitable when I decide to be in the office. And when I decide to not be in the office, I don't want to be worried about my office and feel that I should be there. So those are some key things. But this is my Webster definition of efficiency. And I think it's good to just review that. It's not just about making more money or wasting money. It's really about energy and time. I hate wasting time. How many times do you hear people, well, I just don't have time. I just don't have time. Well, last I checked, a second has always been a second. Since we've had clocks, seconds haven't sped up, I don't think, and they haven't slowed down. So it's our relationship to time. And one of the things that we've noticed in working with practices is that it's our relationship to time that is the imbalance. It's not X amount of time for a root canal. It's our relationship to this time where we're trying to fit too many things into a given set of time. And if you ever come to my practice and observe, I think you would probably be very amazed at the fact that I'm not really working that hard. There's very little things that I have to do in the given course of a day other than just treat the patient. But when we look at all the other things, the energy that goes into putting out this fire and that fire and this fire and that fire, pretty soon I'm so tired. I can't do 2 or 3 more root canals. And we just keep going through this process of getting more and more tired and more and more tired. So we want to clean up our relationship to time because it's how we're related to it. So we do a lot of questions to patients, our referring offices in our area, and even with the endodontic practices that we work with, we want to, when we initially start working together, ask about, how important is efficiency to you? And this was interesting to me. 93% of patients are concerned about efficiency in an endo practice, right? They don't want a root canal that's going to last 2 hours long. They don't want to come for a consult and then have a 2-hour root canal. They want an efficient endodontist. This is from patients. This is what patients tell us. And I think that's really great because 9 out of 10 patients want you to be an efficient endodontist. Of the referring offices that we talk to, right? 95% want an efficient office, right? And many times you'll notice that maybe in your area where the referring dentist is trying to call around to try and get patients in and just, can't get in there. And so they're calling here. And as endodontists, we get frustrated. It's like, well, why do they call us once a month? But they are just looking for efficiency for their patients. They want a scheduling team that can get patients in, get them taken care of, and get them out of pain. But the most interesting thing, and I hope that this number is going to raise after tonight, only 35% of endodontists are really concerned about getting efficient, meaning I'm going to get my root canal procedure as efficient as possible that I feel comfortable with, right? And I'm going to do whatever it takes to get it there, right? And that includes me training my team to take things off of my plate that I really don't want to do, or I can train them to do even better. Because if I have more energy with me, I'm going to be better with patients and be able to stay a little bit longer and take care of more people. But it seems to me that all of these numbers should be about 95%. I mean, efficiency is the hallmark of what we should be about and be the leaders. So I hope that we can kind of switch that. I also have noticed in our area that when GPs get frustrated, what do they get frustrated about? Usually not your treatment, whether you're using lasers, gentle wave, they don't care so much about that. Their number one frustration is they just can't get patients into your practice, and sometimes my practice. And what does that lead to? That leads to the GPs saying, well, forget it. I'm not going to send the patient to a specialist. I'm going to do it myself because I can get them taken care of today, and they're going to do it. And as we know, it takes maybe a year, sometimes 2 years, and sometimes even longer for a root canal to fail. And so this idea of short-term success kind of leads to this as well. So it is important to our specialty. I feel we should be the most efficient root canal providers in the world, right? I mean, patients should just literally, once they hear, oh, you need a root canal, I need to go to the specialist. No, I'm not going to have my general dentist do the root canal. I appreciate all the other work that you do. I want to see a specialist that just is efficient and going to get this taken care of. And one of the little tools that we've used with a few of the younger dentists that are do-it-yourselfers is we say, look, okay, it's okay if you have a patient that says, hey, I don't want to go see another special, another practitioner. And so when I go to lunch with those dentists, I say, hey, well, let's set your root canal fee like twice what the specialist fee would be. And they look at me like, what do you mean? Because the way to refer that patient would then be, hey, Mrs. Jones, I can do the root canal. It's going to be incredibly expensive. It's going to take a little bit longer because that's just the way the business runs. Or you could go see the specialist that's going to have it done in half the amount of time, and it's going to be more affordable. As a patient, which are you going to choose? I would probably go with the specialist, less time, and it's going to be less expensive than my general dentist who doesn't have the technology or the training or the skill set to do that. So just when you're talking with some of your referring offices, tell them to set their fees incredibly high. So if they do have to do it, they're at least going to get a profit. And then if they have to come see you for the retreatment, they'll like, wow, this was really affordable. That's great. So efficiency does matter. And this is this idea that, even 1999, 95, these years when, efficiency and single visit endo, that was condemned by many programs, many speakers in endodontics. And, it was like single visits, ridiculous. Nope, never going to do it. And many offices still have just recently switched to maybe thinking about single visit, but it's the technology that kind of pushed them into that, which I think is great. But now I feel that everybody knows that single visit endo really is the way to go. And that's what we want to get at. So these are the things we're going to talk about. We're going to talk about technology, my triage call process, and how we make it so we only have to do standalone consults on maybe 10% of the patients that come to us. And what are the things that we go through? And scheduling, that's one of the big things with incorporating GentleWave into a busy schedule. One of the biggest questions and the most frequent questions that I get is a practitioner who is, let's say, doing 6 to 7 cases a day and has heard these stories about GentleWave slowing them down, have to make a platform, there's excess bleeding at the end of the procedure, and now they're going, well, that means I'm probably going to be doing 3 to 4 cases a day. I don't really want to spend that kind of money. I don't want to do less cases. I want to figure out how to do more. And we'll look at my schedule and what me really trusting the technology and what it has allowed in my practice as we get to that point. And then we'll kind of dive into the clinical efficiency of ways that you can literally, after our meeting today, really do some thought and really go into your practice tomorrow and start looking at some different ways of doing things that will allow you to be a little bit more efficient. So back to when I was thinking about adding technology, there has to be 3 things for me, and this is just my opinion, that have to be there for me to bring on technology. 1, patient has to benefit. It has to be outcomes for them, less postoperative pain, less flare-ups, like they just feel like they're in a high-tech office, and we know what that kind of feels like as a patient. It has to make me more efficient. And as we'll look at some of the other technology that's out there, it might check 2 of those boxes of, patient experience, outcomes, and those kind of things. But does it make the practice and you more efficient? Or are there things that technology allows you to maybe stop doing? And this is kind of a key aspect of, in my opinion, the GentleWave procedure. And there needs to be a return on investment. in my opinion. If we're charging and billing and doing the things right with this technology, this can be a profit center for the practice. So really important. So real quick, you guys, CBCT profitability, I'm assuming that everybody is every patient that walks through your practice door gets a CBCT. This has been a nice shift as well, because I remember hearing that, only for retreats or surgery will we do a CBCT, or resorptions or things like that. Every patient that walks, even a tooth number 8 that is just straightforward, everybody gets a CBCT. And I just think that's the standard of care. And one of those things that I think is important. So the cost of some of these things varies from day to day. So there's a range. But if you look at how many cases you do a month and what your fee is for the CBCT, this could be a profit center for your practice as well. And we do a thing called scan days. And that's one of the ways that we manage with the bottom 20% of our referral list that always seems to send headaches, angry patients, broken files. The dentist tried it, it's calcified, and all of these things that sometimes seem to waste our time. Somebody says, well, how in the world can you do so many cases a day? It's because we've really targeted in on the dentists that don't do any root canals. I've had days where it's tooth number 8, tooth number 12, tooth number 5, tooth 13, tooth 29, 28, maybe a molar every once in a while. And I love molars, but when we really focus our efforts on marketing towards these practices that don't do any root canals, that's when things can really take off for you. The ideal situation is to have maybe 12 dentists that send you 10 cases a month, and you are going to have the easiest cases in the world. It's the bottom third of our referral list that seem to be the more difficult aspects of what we're trying to get through. But anyway, the CBCT is a way that we help the bottom third of our referral list, because we call it a scan day, where the patient comes in, fills out all the paperwork. They've triaged the best they can on the phone, but they know that there's some story here that we're needing a little more information on. The dentist never sends x-rays, never sends bite wings. Patient hasn't been, brand new patient to their practice. So you see a pattern with these types of offices, but we don't want to shut them off completely, because, everybody's in a process. And so we use our CBCT to kind of be the scan, which means the assistant is the triage person chairside and doesn't take any of my time. And we can talk more about that in the Q&A, but you can see all these things, right? So any activation of irrigation is great, right? So this is one of those things that if you were testing the waters, this is probably better than just a hypodermic needle, obviously, because we're activating it. The cost, you can see, easy to use. Is it effective? I think it's been proven that tip ends up hitting the side of the canal wall and doesn't really do what it's supposed to do in most cases. But I have one of those, at least at one point. We've got the laser, estimated cost per patient, the fees, what it costs you. This is one of the things that just made no sense to me from an efficiency standpoint. I'm a very big picture person. I like repeatability. I don't want to be checking tips and all of these things that can happen with a laser, and switching tips and all of these things, which just kind of makes me so full of tension and stress that I get irritable in some cases so I was literally like, no, I cannot do that. So this one didn't hit the mark for me. Is it good for patient outcomes? I've seen absolutely stunning cases with lasers. Absolutely. You're still using your same instrumentation technique in most cases. And this did not really fit the bill for efficiency. So just something to think about. In my practice, we have 2 G4s. And the reason why I did that is because it makes it easier on my team. And being able to do 6 treatments per machine without having to change fluids and all the things that would have to happen with the G3, this was a no-brainer. And this just literally makes it so the patient's the center. We're not waiting around for technology to be moved. And I highly recommend you looking at the G4, because to me, this really hit the spot. And I know price fluctuates, and cost per patient fluctuates too. It's depending on all of the variables on how you make your platforms and things like that. And we really like to be as efficient as possible with materials. And so one of my favorite things is my platforms for GentleWave have gotten smaller and smaller and more occlusal heavy without using a lot of the other things. But you can quickly see we charge $200. You can see that if you're tracking this, and I highly recommend if you're going to jump into this technology, is you can kind of track your own profit center with GentleWave and see how it's going. You know what you're charging the patient, you know what the costs are, you know what the expenses per month, and you can kind of see that this can be, plus the savings on files. I think that's one of the things that's very important to look at. On my file pack, when I'm treating patients, I have 2 files, and most cases use 2 files. Some don't even use a file. Those teeth that we get into and it's just fluid inside. I have to stop myself because I still feel like, I just need to. No, it's fine. I'm getting better and better at just letting the GentleWave do its thing. But to me, out of all of this technology, there's only one that fits my 3 requirements, and it's GentleWave. Less files. I can give the PI to my assistant. And so for every patient that I treat, I have 8 minutes that I can walk away, get a cup of coffee, transition to the next patient. So this idea of efficiency fits this technology so impeccably well. And just it has changed my life. So let's talk about how in the world do we get a phone call comes in, and then how do we get the information from the patient for my front desk team? And people start to get nervous when we start talking about front desk teams, making the decision that this is a treat. That's the doctor's job. Well, okay, fine. That'd be like saying a triage nurse really can't be talking about what maybe some options of treatment might be, and we'll talk to the doctor if there's a lot of questions and things like that. But one of the most important things that allows for an efficient schedule is making sure that your team understands all of the symptoms and the whole story of from a tooth getting a simple filling, normal postoperative pain, to what could be starting to simmer and start to lead to reversible pulpitis, to then irreversible pulpitis, and then necrosis, and all the interesting things in between all of those, and what are the things they're looking for. And so when we hire people at the front desk, we have to have excellent communicators. They have to be so curious about what's going on. Tell me, well, that doesn't make sense, right? And so I sit with my front desk team, especially when they're new, at least once a month, where we spend time on this is the story of a tooth. These are the signs and symptoms that can pop up. And they start to actually understand this process better than most of the general dentists that send us patients. And I look at that as my responsibility. If they're going to be helping me with my schedule, they need to know kind of where to put patients. And we want to make sure that they know the common urgent symptoms, palpation tenderness. What does that mean? Or a swelling, or they're not feeling great, and all of these things. And so they learn to form clinical impressions. They're able to talk to the patient, having enough people at the front desk so that you can, we actually time everything in my practice, and it's about a 22 to 23 minute from the moment that phone rings for us to go through our call triage, and then that decision of, hey, this sounds like a treat. No, this doesn't sound like a treat. Let's just have you come in for a consult. The doctor can take a peek, or we, do a scan appointment for them, so the doctor can review the images before we have a possibility of what would be best. And really just to be able to talk to the patient. We want that patient to feel like, there's no rush. Oh, can I put you on hold? That feeling of like in a busy practice, if we've got too many distractions for our scheduling team, we're missing the entire boat. We want to make sure that every time that phone rings is a potential treatment, and we don't want things to fall through the cracks. We want to get them in and get them taken care of. But we train so that they can do brief, focused assessments. Mrs. Jones, tell me what's going on with your tooth. How long has that been going on? And so now they're able to come back and talk to the assistants or talk to me every once in a while and say, hey, this is just a little kind of a strange case. Do you have a minute? And so we can talk briefly about, okay, right? Because everything that we spend time with our scheduling team, they're going to put that back somewhere in their mind. And so the next time that pops up, they're going to know most likely how to handle that. And they need to be able to multitask up front. The phone's ringing, somebody's checking out, someone's coming in, emails are coming through, all of these things. We're checking insurances might be calling back, or all of these things, right? The doctor might need something, the assistants might need something, or pulling charts, right? We have to have this idea of this is a really dynamic environment, and that's where the secret of a profitable and efficient office comes, is from the front. It's not the doctor. Well, it can be, but having your team refined in such a way that this becomes just common. And my three front desk people, not one of them were ever in dentistry before at all. So I don't tell me it can't be done, because I know it can. And dental experience has nothing to do with it. What that critical thinking and those things, that's the people that we want to get, that want to make a difference in people's lives, but it's because they can prioritize the treatments versus a non-treatment. Very, very important. And this is the brief triage call that we think is important, because we really pay attention to our referral tracker. And when the very first, who can we thank for sending you to our practice, right? So that we know that who our top 20% of our referring list is, we treat those 20% different than the bottom 20%. So we have to know who's sending that patient, because we have a history. We keep track of the kinds of cases that these dentists send us. And usually that bottom 20% does not change that much of the kind of cases that they send. We're not putting a judgment on the patient. We're just saying there's always a problem. And I don't mind problems. Matter of fact, I kind of like some problems. But if that's all I'm getting from somebody, that's not a fair game for me to play. And I don't really want to play in a sandbox where it's not fair. I don't want to keep getting hit with a shovel and I wasn't really paying attention. So we want to protect our practices. We want to protect our teams, because 80% of our headaches and stress and chaos come from 20% of our referrals, just like 80% of our profitability comes from 20%. So that 80-20 rule applies so much to how we're talking with referring dentists and the kind of cases they send. But we want them to just immediately get into the signs and symptoms. The rule is to have at least 2 without any other things that would say, oh, this, anxiety can be that, medical things, uncontrolled. Those are really the only things that would make a standalone consult in my practice, is anxiety, or somebody uncontrolled diabetes, or heart attack yesterday. Those kind of things that would say, hey, why don't we just have you come in? We'll take a peek. Because when we're focused in on that, we're in charge of our schedule. And we hinted a little bit about what that looks like If we're doing consults on every single patient, the snowball's going, new calls are coming in, right? So you can see that all of a sudden now we're booked out 5 weeks, we're booked out 6 weeks. And when we get booked out that far, you're going to have no shows because they got in somewhere else. They're going to just all kinds of things happen. And I'm sure some of you have experienced that, as we all have. But being able to talk finances on the phone, checking insurances, and getting those refined skill set on how to talk to patients about finances. And then we want to put that patient right in the schedule where we want to. Is this 100% always work? No. But 90%, 95% of the time, this works. And it really empowers your front desk team to really get after and really help know that they control your schedule. And I love this. Peter Drucker was a business management guru. And this is so simple, but so great because it applies to endodontics. If we're not measuring something, we can't improve on it. And I think when you go to your practice tomorrow, I would look for many different ways to measure things, measure things for, the timings in your practice. That's a measurement. How do your assistants know that they're doing a great job without you telling them they're doing a great job? How does your front desk team know that they're doing a great job without you telling them they're doing a great job? I used to think that was the way we made our employees feel good, but I want to have things in my practice that allow us to be able to say, okay, accounts receivable, it's only 2 weeks of production, they're doing a good job. They know they're doing a good job. If it's 3 months of accounts receivable of your production, that's not a great job. We can tighten that up. So we want little data and measurements along the way. And this is an incredible book. I highly recommend this for people to read. There are 3 things that make a job miserable. And, this idea that there's no measurement. So I don't know if I'm doing a good job or not, right? And many times when we look at scheduling and things like that, we have all kinds of different kinds of schedules, and there's really this kind of checking in with the doctor throughout the day, and there's this chaos because the assistants don't know how the patients are coming in and who gets what patient and which operatory does it go into. It can just create a lot of chaos. So we want to really have things that we can measure on a day-to-day basis, and those are not difficult to come up with for any area in your practice. We want to know our team members, right? We want to make sure that we spend time getting to know who they are. If we work in a practice where nobody really asks us any questions about our lives or how we're doing or how our families are doing, how our pets are doing, that's a sign of a potentially miserable job. And we don't want that. We want to make sure that people feel that we know them. And so in staff building things, finding ways to really get to know your teammates and share some of yourself. Sometimes when we share some things about ourselves, our staff feel closer to us as well. And this idea of irrelevance, that does my job even matter to anybody? Well, quickly in healthcare, we can see that our jobs do matter. We're relieving disease, pain, and now we have all this technology at our fingertips that allows us to do it in such a refined and efficient way. I mean, this just is calling us to just keep our practices moving in this direction. But helping people see that when an assistant spends extra time with a very nervous patient and has the time to be compassionate and just that great presence for that patient, that matters, right? So we look for ways that we can help our teammates see how their job matters. And it's not just because the boss is happy. That could be one of the measurements, but I want things to be very upfront, and so people can really understand those things. Okay, so let's look at scheduling. I don't care how many operatories you have. We work with an office that has 11 operatories. And this is the schedule that they run. It's two columns. One, the left column is treatments. The right column, for lack of a better term, are, we'll call it time wasters, because that's a good way for scheduling teams to kind of look at it. And it'll all be very clear when you start using two columns, because it just is one right after the other, and the transitions and flow for the day gets very simple and very easy. And again, contrast is the essence of vision. I'll show you a few schedules here coming up and want to see how you feel about it. But we want to set our goals. What are the goals that you want to achieve in your practice with this technology? Because I really think that we're the limiting factor, and our systems are probably the most limiting factor, because this technology has the same amount of time every single time it runs, and we just need to incorporate our lives around this and make that the center, because that is the procedure. And I think that helps us set our goals too. And don't be afraid to set lofty goals. I think that's one of the most fun things, because regardless of where you set your goal, you're probably going to hit it. So why not err on the side of kind of shooting for the moon every once in a while and just see? One of our clients kind of did that, and for the first time did 9 root canals in a day, and was just so blown away, and his team was excited, and just it's fun to see that. It just is like the technology is doing it, and we're listening. So, and the abilities, sometimes people aren't able to grasp letting things go, and we work with teams that have a little resistance to that as well. But it's about flow, focus, and the nice thing is systematic production. When every day looks technically the same, maybe longer some days, maybe shorter other days, but there's a system to it. Your front desk team knows where to put emergencies. They know where to put consults if they have to. They know how much time an APICO would take. They know how much time a retreat, if you have different times on these things. And it's the only way to get there is to be able to time what you do so that a schedule can kind of be made and hit your goals. And that's just an efficient way for your, so nobody comes and talks to me about the schedule on a given day. And that one of the practices that I was hearing about, it's like they wouldn't put a patient in the schedule until the staff came and talked to the doctor. Well, this is from Dr. So-and-so, and we're not sure where. So the doctor would look at the schedule and then tell them where to put the treatment, and then they would have to go do it. And it was just like, we want to empower our teams to make these decisions for us. I mean, we have bright office teams. We just have to let them loose on the schedule and make the day happen. So there's just some random schedules, right? And I look at that and I go, oh my God, I wouldn't know what to do. I would not know where to go. I know that my assistants would probably be scratching their head. What time did this patient get here? Who gets seated first? What do we do? This is chaos. A little bit better. But again, this idea that this is the same practice too. So we've got 2 different schedules and no rhyme or reason to how that goes. And this is even a little more bizarre. How in the world are there transitions and flow in that? Very difficult. So we need to get our goals. We need to give up our control as endodontists. We always hang on to things way too long. We are perfectionistic control freaks, recovering. And we really just need to empower our team to make the day work. And I think that's really the power of a great run office. And we want to get away again from doing consults and then having to reappoint the patient. And we just want to do true single visit. And you only do that by having a good triage at the front. And that right column, the time waster column, we want to minimize those things. So part of the goals is like, I only want to do 2 consults or 3 consults on the right. And so I want to do 8 cases a day, and I want to only do 2 or 3 on the right. It's that simple. There's your goal. There's your template. And where do emergency slots go? So your staff, they don't have to come ask you, oh, so and so has an emergency, what should you do? Because I'm sometimes inclined to say, maybe no today. uh, but I love it because my team will lead me through the day, and they'll say, hey, we got an emergency from Dr. Jones. I don't have to think about it, because if I have to think about it, I'm usually going to do some crazy decisions. But if you're a practitioner that's trying to grow your practice, right, this is the way to really get growth happening. Because when you look at the average endo practice, if you're able to get patients in and get them taken care of in a more timely manner than the other offices around you, you're going to get your foot in the door. And that's how we do it. And it's not by following the average of being booked out 3 weeks and feeling good about it. Because again, you don't want somebody to come and set up practice right next door to you, and then they're seeing the people that you booked out 3 or 4 weeks. We want to take care of our schedule and make sure. So this whole idea of efficiency, it does matter. And I'm going to focus in on the business side of it, because just adding 2 more cases a day, that's it. So if you're a practitioner that's doing 6 cases a day, and you can fit in 2 more cases a day, and I do know that on average, we as endodontists waste about 3 hours to 3.5 hours of our day doing things that we could be having our staff do. We could train exactly the way we want them to be done and delegate these things to our team so that we can focus in on being the center of the practice and treating patients. Just 2 more cases a day, it's almost a little over $500,000 a year. And most offices have no problem adding 2 more cases a day. That's maybe not taking lunch, maybe moving a little bit faster in your walk between operatories. Not a big deal. Most of the offices that we work with, they've increased their number of cases per day by 3 and 4. And you can kind of quickly see the impact of getting efficient clinically and having a team that can do that. It's almost $1 million more a year just by becoming efficient. Because what typically happens is we become very aware when we start moving in this direction. All of a sudden, it's like, well, why am I doing this? Okay, I feel so good with getting rid of all this other stuff. I want to get this off my plate too as well. And it just becomes this, like, the intention of it, you just move right into it. So efficiency does matter. Would everybody agree with me? Just from a financial aspect, because you're fitting in more cases, you're probably going to get easier cases the more that you run your schedule this way. And let me tell you, there's nothing better than easy cases with Gentle Wave. It literally is the most fun, the most I literally sometimes go, this is my job? I I almost kind of laugh. It's like, this is great. This is so much fun. And we're getting a lot of patients taken care of too. So this is that power of a scheduling team. And you can see the patients. This was a day that I thought there was going to be 5 cases. This was from several years ago. We have a different template now. I thought I was going to have time to go. The front desk scheduling team literally just kept filling in into those treatment slots, one right after the other. And even a consult that was a standalone consult got fit into the very end of the day. So that was still on the same day. So that day ended up being 10 cases, and that I didn't really have a chance to look at the schedule. And then all of a sudden it was just like, oh no, we got one more. Oh, we got one more. And that was just a fun day. I mean, it just was like really great. My team really took care of it that day. So a little bit of my struggle with Gentle Wave, and we'll get into the more clinical side of things here, is that when I bought it, I was already kind of a single visit person. I know, terrible me doing single visit with big files. But that's just the way I practiced. And, I thought it was great. And I bought Gentle Wave, and I came back, and it was one of those practices like, how in the world am I going to do 8 cases? And I have to build a platform, all this stuff, extra bleeding. So it ended up just sitting in the corner, collecting dust. And I didn't trust it. I felt it made my life more difficult. Um, I really looked for reasons to not use it. And, no, not going to use it, and the team would go, oh, thank goodness, I didn't want to wheel that thing around anywhere. I got frustrated and literally had buyer's regret. I mean, I also kind of started thinking about like, how in the world can I get rid of this, get it out of my hair? Just want to go back to, doing the day the way it was, felt. And so Dave Archibek, who so glad's back at Son Endo now, he was one of the main ones that said, Rick, what are you doing with this gentle wave thing? You need to go to a course. And that's where I met some endodontists, Jimbo and Brian Facer, and they were a little bit further down the path as I was, as far as trusting it and using it. And that really lit my fire. And I said, okay, is this the best way to clean a tooth? Yes or no? If it's no, keep spinning your files. If it's yes, now I need to change my practice and my techniques so that I can incorporate this. And that's what I did. And so this is my scheduled template now. So it allowed me, using GentleWave has allowed me to increase my practice by about 50 to 60%, a given day. And you look at that and you say, how is that possible? Well, this is doctor and patient time. So that 8:30 patient that comes in is coming in at 8 o'clock. And the assistant's taking that patient back and doing all the things to get the CBCT, verifying that is the story that's going on, cold sensitivity, whatever. And so that when I walk in at 8:30, I know the story, and the patient gets anesthetized, and we get the gentle wave going. I hand the gentle wave to the assistant, and then that next patient is ready. So I have 8 minutes to go in, talk to that patient. And again, when we're really dialing in that triage process, these are just patients that know why they're there. There's no questions. They're appreciative. And we just roll through the day like that. And so efficiency does matter. And does every day look like that? No, absolutely not. But if it's a day of only 6 or 7 root canals, the day is done early, and I don't penalize my dental assistants if because I'm efficient. So we have a set number of cases that if we hit that number, that they get the full day, and there's tons of things to do that we have them do. So anyway, it's good. But sometimes when people start hearing about this, they start getting very worried about this idea of making things more chaotic and stressful. And that was one of the things with GentleWave, is I was like, no, this is the best way to clean a tooth. I want to incorporate this into my practice so that I can maximize this technology, and that we're reacting to what it can do, its potential. And so when we're looking at offices and what we don't want to be in this high anxiety where we're challenged and we're sweating all day and we're stressed out. And we also don't want to be bored. And I think there's a lot of endodontists that have kind of gotten to that. Is this all there is? Is really 4 to 5 cases a day. Maybe that's, I don't want to do more. I can't do more. They feel that they're maybe burnt out a little bit, but there's definitely some potential that we want to be in that flow, and everybody's got that different idea. And I think most people's flow starts to kind of increase a little bit, where, I never would have thought that I would have been able to do 15 or 16 root canals in a given day. And I'm glad I don't, because GentleWave has made that so much easier and so much more efficient that I wouldn't have believed that. But if we keep our minds open and just keep moving through this path and keep refining the systems and things like that, we will get there. So my clinical efficiency tips, and certainly when we look at specific techniques, everybody does the same thing. We have to access, locate the canals, whatever instrumentation you do to locate and make sure that there's a pathway for the gentle wave to work. But we work a little bit with some offices that thought that they needed the lasers and they needed the gentle wave, and they have some other toys and gadgets. And so when we go into look at how they're operating a given day, this one gets a laser. And one day, one got a laser and a gentle wave. Another patient got two gentle waves because one just didn't feel like it was enough. So might as well do it twice. And still didn't complete the case. And when the patient came back the third time, they did a gentle wave again. So that's three gentle waves. So that's not trusting the technology. We want to simplify. We can't get into a routine and flow if we're constantly looking over our shoulder and like, oh, I need the, oh, I know I want to try this. All of these things. It's chaotic for your team. It's chaotic for you with the fact that there's too many multitasking things going on. We get really efficient as endodontists when we simplify and make things just as easy as possible. And one of the ways that we do that is by having people, clinicians, write out a script. Like, okay, patient comes into the practice. These are the things that are going to happen. These are the things that are talked about when the patient's there, all the way into like the exact verbiage of like, okay, patient is just got seated. Assistant's going to be asking these questions. When the doctor comes in, what does the doctor say? But then clinically, start like from the very first thing, right? We develop hand signals for, when my hand goes out like this, what does that mean? When my finger on my left hand goes like that, what does that mean? We just don't have to talk about the procedure at all because it's just a memorized script and it's like a play. Because when we're moving in this flow and this kind of efficiency, it has to be easy or it would be just miserable. It has to be this natural flow. And when I talk to dental assistants in practices, I talk about this is like you're learning to dance. You're learning to do a dance that you've never learned before. And you and I have to figure out how these movements all come together to synergistically get where we want to go. Are there awkward moments? Absolutely. But rehearsing and going through all of the aspects of the treatment so that everybody knows the roles, who's talking about what, when is this said, when's the best time to talk about this, and that. So in my practice, I build the platforms and I do the first probably 30 seconds of the seal test, and sometimes 15 seconds. I mean, just depends on kind of where we're at and what's going on. And then the assistant just comes in, sits down and takes over and allows me to move to the next patient. And usually the timing works out perfectly so that when they're done with the gentle wave procedure, they take the platform off, suction out the tooth, and I'm coming in, and then it's paper points, sealer, master cone, check film. So there's actually another transition time there too. Transitions are one of the most important things. So that's another little measurement for your dental assistants and the doctor. When we talk about transitions, it's how do you move from one patient to the next? Many offices are it's start, finish, wait for the next patient. Then it's start and then finish and wait for the next patient. But every time we miss that transition point, which means at some point it's okay to get up from that procedure and go meet the next patient, provide anesthesia for that patient, and then go back and finish that case so that when you come back into this operatory, that patient's ready to go. The assistant's tested the tooth, it doesn't respond to cold, negative to percussion, put the dam on, away we're ready to go. And that's really as complex as it gets. This is not about having 5 patients in chairs and 5 gentle wave, 5 gentle wave machines, that'd be great. But it's not about chaos. It's literally just about overlapping what you're doing in a way that feels okay to you and not getting clouded down with all these other things that we do, responding to phone calls, responding to emails, staff coming to talk to you about things that they should really talk to the office manager about first. Or some offices have this idea that I need to tell the doctor all the things that I did so that they know I'm doing a good job. And again, my brain is very singular focused when I'm in the practice, is like I'm just concerned about the patient and getting the root canal done. That's it. And at the end of the day, if there's something I need to know, we can talk about it there. So my dental assistants and my front desk team help manage my time and help protect my time. And very, very, very important. But trusting the technology, and like I said, 1 to 2 files is all I use. 1704, maybe a 2004, never more than that in a necrotic case. And if it's a vital case, like maybe a barbed brooch to pull out palatal tissue or something like that. But the other key thing about clinical efficiency is being able to use intraosseous anesthesia. We all know the studies, and yet there's very few endodontists that really feel comfortable using intraosseous anesthesia. And if I had a day of nothing but tooth 19 and tooth 30, or even 18 and 31 all day long, all irreversible pulpitis, guess how many times I'm going to be using intraosseous anesthesia? Every single patient. I just don't want to be the endodontist that puts the dam on, begins to access, and right? Immediately, my back starts to sweat. I get nervous. Patient says, see, root canals suck. These are horrible. Why would I, blah, 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 right? So this whole story can just kind of really derail a day as well. And I want to do everything in my power to make this as easy and as pain-free an experience. And GentleWave fits that, right?
Rick,
Yeah.
are you using intraosseous as a supplemental or just as your primary?
Supplemental.
Okay.
Yeah, standard block, make sure the patient has lip and tongue. I do a little PDL when I come back into the room after finishing the other case. And then we go right to the IO. I usually go distal to the tooth we're treating. Sometimes mesial, but I prefer distal. And 3% plain, bupivacaine, usually one cartridge. And it literally is a 20-second procedure. The assistant just hands everything. Very simple, very straightforward. We can put a video out there of me doing that. And let me tell you, it goes from, what were the number, 56% irreversible pulpitis with the standard block to like 92 or 93. I mean, if that's significant, and it certainly helps your patients relax and helps me feel better too. And conscious sedation as well. Those are things that make just the procedure, once you get started, make it just as easy as possible. Time everything in our practice. And we want to get rid of this idea. This is one of the things that gets in the way of us really opening our minds. We're either tied to perfection, where it's never good enough. I need to do standard instrumentation and then run the GentleWave. Oh, and I probably do the laser too, because you never want to leave any stone unturned. Or it's chaos, right? It's just like nobody knows what's going on. The patients are late. There's no systems in place. But we really want to be down in that zone where there's no chaos. We've given up perfection, and we're ready to just have fun and do the best we can, do an excellent job. So we want to trust the technology. So unfortunately, this is kind of the song. The day does go by, sometimes fast, but we have to know that we're the pilot of what's happening. And like just a slight little shift in our practices, right? If you just want to incorporate even one extra patient a day into your schedule, maybe 2, eliminate the right column, train your front desk team to really be able to triage the best that they can, and get everything off of your plate so that you're the leader of the practice and not the manager. Just real briefly on what we do, and I think Chrissy is here as well, listening this evening. I think I saw her picture. Some of the things that we've learned from offices that have worked with us, right? So first off, the new possibilities, and hopefully you've been able to maybe identify some things in your practices that maybe some opportunities and things that you hadn't thought about. But this is my path as well, is that I realized that I just really loved endodontics again. And using this technology and getting systems in place, all of a sudden we're not burnt out anymore. We're excited about the possibilities of going to work. getting rid of being the manager of the practice, hiring somebody to make sure that they're looking at these all the key uh, components of a practice and making sure that they know how to report those things to you. That's part of us leading the practice and feeling unencumbered is really having somebody else run the practice, and we can just enjoy what we do, and maybe every once in a while make a decision that impacts everything. But that's a sense of freedom. It's like, if somebody just wants to do X amount of cases per day, that's great. Let's get it done in a reasonable amount of time so you can go enjoy your family and your hobbies and things like that. um, I think the shift that I've seen with many people we've worked with, and myself as well, is that we get out of this perfectionism and this idea that we have to be perfect and every case has to be absolutely, you know, like a textbook. And we know that real world endo is always different than a textbook. We always want to show all our best cases, and I get that. But really, what I want to be is excellent. I don't want to be perfect. Excellence is a much more opening and an exciting thing. And the biggest thing is this: gaining the clinical efficiency, giving up some of these things that we think are so important. And in current modern endodontics, I don't remember the last time I stuck a 4004 into a tooth. It's been a long, long time, even a 30. What some of the results that teams talk about when we kind of ask them what they've got out of it. So this idea that the team starts running the practice, right? The front desk team feels empowered to be able to make decisions on where patients need to go, and the doctor doesn't have to worry about that. The doctor is just the machine in the back, just going right through, doing the work, and who's next, that kind of a vibe. Getting the systems of the practice. So many times in our practices, it's like we have these drawers, and I remember I didn't really want to go look for things because I was afraid about what I would find, right? Because as a doctor, we're usually sometimes the last one to know that the train's fallen off the track. And we really take this path of least resistance, where we just don't want to really know how gentle waves getting billed, or how because we're just like, we're dealing with problems all day. I just don't need any more problems. It's time for me to go home. And that, but just to get the systems in place so you can check in and see how things are going without too much effort. That's just a beautiful space to be in your practice, and of lots of hands-on training. And that's one of the things that Chrissy is involved with, and I'll introduce her I think the next slide here. But modern marketing plans, it's not about dropping chocolates off to offices. There's a deeper sense of how offices respond when we start talking about things, the why. And that's such a great way to base your marketing plan on not what you do, but why. Why am I an endodontist? Why did I open my practice? There's so many different ways of making meaningful contact with offices, and not just stopping in and dropping chocolate off. But really just getting the team organized, eliminating this chaos and stress that happens in endo practices. But we want to minimize that, and we want to laugh about it when it does happen. And we empower teams and get those things in order. Now the office feels like it's lighter, it's easier, and it's really ready to fly. And those are the things that make us excited. So this is Chrissy. Chrissy's there. I don't know if she's here. I think she is. I thought her earlier. She works with me. She's director of operations at Endo to Endo. She's also a neurotransformation coach, where sometimes when change occurs, there's a lot of resistance that can sometimes build up with people. Fear is another thing. This is the way we've been doing it for so many years. And Chrissy's just an expert on assisting teams and doctors on really moving through some of those roadblocks that get in the way of seeing what the possibilities and of things are. But she's had 26 years of endo experience. She started as a sterilization tech, then moved into dental assisting, and then front desk, and then office manager. And And so we've really devised some programs that really are impactful. And it's just great to be working with Chrissy. And if anybody does have any questions about what we do, you can take a picture of that and it leads you right to a scheduler. Make an appointment to chat. We love to chat with people. I One of my favorite things is talking to endodontists about how their practices are going and what's working and what things would you like to see changed. And because I've been a proponent of change. Change is not really scary to me anymore. It used to be, and now it's just this exciting way to move into something new. And I think Gentle Wave was one of those things that literally set my practice on fire and kept me from probably wanting to retire or do something crazy with my practice. And so I just feel really grateful for that, but would love to chat with you. If you need that, we can put that back up too. But in closing, just remember, as you're looking at your practice and there's things that maybe bother you, or you uncover something and you're like, oh my God, what's going on here? I can't find this, or I need staff, all these tension things that happen. But just remember that there is a solution to every single problem. And it sometimes takes a different perspective, obviously, but there's a way to overcome, work around, conquer any and every apparent obstacle. Because really, an obstacle is just maybe something that we're just looking at in a slightly different way. Or maybe a slightly different perspective might make that totally disappear. So there's hope in that. There's also excitement about that. So never get stopped by something in your practice that you're afraid to find out about, because there's a solution to everything. And I think that's cool. There's Chrissy. Okay, that's it. Thanks for hanging in there, guys. I know I get going on these things, and I never want to kind of stop. So I'll release sharing my screen here, and would love to hear questions, whatever.
We have one good one in the chat. What is your exact instrumentation sequence?
Yeah, okay, perfect. I thought about getting into that, and then it might get below, just be a little muddy. So obviously access, right, under the microscope, locate the canals. And one of the things that I got rid of, I think it's probably been about 4 years now, and I don't use the Root ZX. I don't use 10 or 15 hand files at all. Now, if it's a really calcified canal, I might try and get a something into that. My assistants measure the canals off of the CBCT, and they write that down on a little piece of paper. So I don't use the Root ZX. Now, I've had to use it one time, and we had a problem with our CBCT, and so I had to use the Root ZX. But so this whole idea of why we get less postoperative pain, less flare-ups, I think has a lot to do with the fact that I'm not taking 10s and 15 files to the root terminus or and pushing stuff out the tip of the root. Because even if you do go to the when you go with your Root ZX and you go past and then back, well, we've already just kind of put some stuff out there that maybe not, maybe doesn't make a difference. So I go right to my 1704, and I use Edge Endo files currently, and I'm always looking for other files that feel good too. I'm just kind of stuck in a rut because we use files differently now than we used to. And so I usually stay back about a millimeter from what that estimated working length is from the CBCT. And then I may go to a 2004, and that's it. And that's under with EDTA in the canals. And then it's literally right into making the platform. And getting that all ready so that the gentle wave can run. It's that
So,
simple.
Rick, which edge endo, since there's so many, and also does bleeding delay your protocol?
Uh, does bleeding? No, because I think when we first started, that was one of the concerns, and I think I was over instrumenting a lot. And I don't know specifically. I'm not a code guy, and I'm not a detail when it comes to models and those kind of things. So I can get that information to you about which agenda it is. It's it might come to me, but it's not there yet. But no, I've not had excessive bleeding problems at all, and I think because of especially staying back a little bit from that, uh, you know, working length just a tad. I used to do it quite a bit more, like with the old Molar PI, but now that the clean flow has changed a little bit too, I'm confident now in staying back in necrotic cases for sure, and in vital cases, just making sure that the tissue is out of the tooth. That's my only concern. I can do that with a barb roach or um, kind of macerate that tissue as best I can, and then
Sure. How long does your coaching last? Is it weeks or months? How do you determine that?
so yeah, so both programs are a year long, and there's the online freedom program, which is a program where people who like to kind of work through their own pace. There's group coaching involved in that. So, but each program is a year. The immersive program is more one-on-one coaching, but yeah, we realize that a whole year is really kind of the process, because things happen when we change, right? Staff might decide that they may not be the right fit at this point, and so it's a process. When we change, we kind of exchange the exterior world environment around us, and so we just want to be right there throughout all of the dynamic changes in a practice, and get people. It takes time to make some changes
It
sometimes.
does. I like that it is a year, because it takes that long to get through everything. Well, last question tonight. When, let's say, a patient is 10 minutes late or you have issues, disruptions, how do you handle that?
Well, I tell the patient, because they're late, we don't have time for anesthesia. Is that okay? No. So we do have a little rule. So in my office, if we have no shows, I put that on my front desk team. That's their responsibility. So we have I don't remember the last time we had a no show. Um, and by the fact that we tell the patient that their appointment is at 8 o'clock, yet in our office, back office, you know, it, they know that patient will be walking in at 8 o'clock. So the front desk has really about 15-20 minutes. If that patient isn't there at 8 o'clock, they're immediately, hey, are you on your way? But let's just say that the patient cut into 10 minutes of my time. I'm okay, because I can transition at different spots through the procedure, even prior to starting, or building the platform. So the key is being able to find those spaces in your procedure that you can get up and make it work, right? Are we going to give up, an $1,800 procedure because the patient was 7 minutes late? Absolutely not. Now, if they are a half hour late, we'll probably fit them in at the end of the day, and that's what they do. They'll move them down to the end of the day and move another patient up, or we'll make it work that way. But we really want to serve the patient. And if they come in and they just are upset and cranky, and they're just no regards for anybody's time, then we'll tell them, it'll be a week until we can see you.
Oh, well, I appreciate that. And that's what comes with experience. It is, I remember when I dismissed my first patient, it is freeing to know that we have that ability.
Yeah, the only time that I will dismiss a patient out of the practice if they are rude and mean to my front desk team. Because my team works their butts off and they are so accommodating and so kind and so they listen, they and for a patient to just be, you know, disregard, just like screw you guys and not even be grateful for the amount of work that my team puts in to make it so they can have a great place and a good appointment. That's the only time that we'll just say, hey, I know you're having a bad day, but this is just not going to work today for us.
Sure.
Come back when you're happy.
Sure. Well, I want to be respectful of everyone's time. We're going to just do a quick wrap up and we're going to put your QR code up again, Rick, right when we get done, just in case people miss that.
Okay.
Everybody, please join us for our next webinar. It's November 20th. It's with Adam Davis. The biggest question we get is how do we obturate minimally invasive canals? This is going to be all about that. So please join us again for that. Please visit gentlewave.com to learn more about our courses and our peer-to-peer education near you. It's a plethora of discovery, so please jump on our websites for that. I'd like to thank everyone for coming tonight. Thank you for the speaker. It was informative. I wish I heard that 20 years ago, instead of late into my career too. So thanks, Rick. If you want to put up your QR code again, people can reach you easily. You're always able to reach out to us at Sonendo. If you need any more information of how to access Rick and ask any more questions. And everybody enjoy your evening.
Thank you, everybody.
Everyone have a good night.